Hello, and welcome to the GRACE podcast series. My name is Denise Brock, and I am the Operations Director for the Global Resource for Advancing Cancer Education, or GRACE. In this podcast series, we interview patients, advocates, and healthcare professionals to provide the most updated information for our community and to highlight important issues facing those dealing with a cancer diagnosis. We hope you find this information valuable. For questions or comments, please visit us at cancergrace.org.
Hi, my name is Arjun Gupta, and welcome to the GRACE Supportive Care webinar series. Today, we'll be chatting about pancreatic enzyme replacement therapy. Joining us today is Christi Walsh. She's a nurse practitioner in the surgical oncology program at Johns Hopkins University in Baltimore and is a tireless advocate for patients with pancreatitis and pancreatic cancer through the National Pancreas Foundation. Thank you so much for joining us today, Christi.
Hi, Arjun. I'm Christi Walsh. I'm just going to talk to you a little bit today about pancreas enzyme replacement and give you a little bit background about the pancreas in general and hopefully answer some common themes in regards and surrounding pancreatitis, pancreas cancer, and enzyme replacement. The pancreas, as you all may know, is a troublesome organ when it's not working well, and especially for patients who have pancreas cancer. The two major functions of the pancreas are, the most common thing we think about is insulin replacement, and the fact that the pancreas produces insulin and other hormones to regulate the blood sugar. However, there is another very important function of the pancreas that we often do not think about, and that is the exocrine function of the pancreas, which releases enzymes into the intestine that mix with our food so we can absorb proteins, carbohydrates, and fat. And so that's what we're going to talk about today, is the absorption of those fats, carbohydrates, and proteins. And when your pancreas is not able to do that, what we do to help you replace those enzymes. Essentially, patients who have pancreas cancer, because the cancer oftentimes will start growing within the duct of the pancreas, hence the name ductal adenocarcinoma, which is the technical term for pancreas cancer. It oftentimes will block either partially or completely of the duct and cause an obstruction where the pancreas juice cannot flow from the duct of the pancreas into the intestine of the pancreas. In patients who have this, they oftentimes present with symptoms of gas and bloating. They often present with orange oil and floating stools, eventually weight loss and loss of vitamins, especially those that are fat-soluble vitamins. And so something we're always mindful of patients who have pancreas cancer. Other ways you can actually have this exocrine insufficiency are when that you have pancreatitis. So sometimes the tumor can obstruct the duct and cause back pressure and damage to the surrounding tissue, which then causes pancreatitis and then can lead to also having this same exocrine insufficiency, or after surgical procedures, when there is either scarring from the duct after surgery, and or when there is a lot of pancreas removed, or even in a total pancreatectomy where they remove the whole pancreas, you would need to replace these enzymes in order to properly digest your foods. And so this is really important, especially if you have a cancer diagnosis, because you have to have good nutrition in order to heal, in order to be able to tolerate chemotherapy. And so it's a very important thing to be mindful of. And so for our patients, they want to know a lot about these enzymes. First of all, they want to know, patients come to us, they want to know what they're eating, how they can help, and the little things they can do. And so taking your enzymes as prescribed is very important in order to, no matter what you eat, if you don't have these enzymes to mix with your food, then everything will leach out into the stool. And you will have this orange floating oil in your stool and not be absorbing your vitamins. And so you can eat as much as you want, and you're never going to gain weight or be at a good state in order to heal, in order to either take more treatments or to recover from your surgery. So a couple of things about pancreas enzymes that I want to talk to you about. And the first thing is that what are pancreas enzymes? So pancreas enzymes, they are an artificial form. So basically in your pancreas, through the duct system, you release amylase, lipase, and something called proteinase. We'll call it that. And essentially all that means is that lipase breaks down lipids, which are fat. Amylase breaks down carbohydrates, which are and then our protease breaks down protein. And the other thing we think about with these enzymes is that for fat-soluble vitamins, you need to be absorbing your fat in order to absorb those vitamins. So those are the things where these help. And so the way to take an enzyme is you find out you have these symptoms, you're either diagnosed with pancreas cancer or you're taking these after surgery in your recovery. And so the most important thing to remember is it has to mix with your food in order for you to absorb those nutrients. And without them, you will not be able to absorb your proteins, fats, carbohydrates, and your vitamins. And then therefore will have weight loss.
So just to summarize, patients with pancreas cancer may need pancreatic enzyme replacement therapy, either because the tumor is invading the pancreas and destroying the gland, or there's dysfunction or inadequate production of enzymes due to pancreatitis, again, destruction of the gland, or you've surgically taken out a part of the pancreas or all of the pancreas to try to treat the pancreas cancer. So now patients are either going to come to you and say, hey, I have symptoms of gas and bloating and oily stools and weight loss, and I'm just not feeling strong. Or you know that you've taken out someone's pancreas and you know that they're going to probably need enzyme replacement therapy. Is this a decision that you can take in clinic pretty easily, or does this usually need some sort of sophisticated testing to confirm a diagnosis of pancreatic insufficiency?
Yes, no, and that's a good question. So, no formal testing is needed before you start taking enzyme replacement for the pancreas. There are some testing that it's sometimes helpful, especially if you have a patient who or you yourself are having diarrhea, and we don't know if the cause is from needing enzymes versus maybe a side effect from chemotherapy. So you can do a fecal, fat test, which is very easy. You just send a stool specimen and you get back a quantitative, measurement of fecal fat, and that is able to tell us whether or not you're actually absorbing that nutrient, and then we can diagnose that. But for most patients, because the risk of taking enzymes is very low and the side effect profile is almost non-existent, most patients don't have any trouble tolerating these pills. I think the biggest kind of hardship that people have is either the financial barrier to get them, or also the size of the pills. Occasionally, people, they are pretty large pills, may have a little difficulty with, but all in all, they're well tolerated, and therefore there really is not much need for any testing beforehand. And we can put patients on them if they don't improve. We titrate upwards just to see, we start at a base dose of usually on average after surgery, it is around 70,000 units of lipase that we usually start them on. And then we titrate up, and then or down depending on their symptoms. And then so it's not something you need like formal testing for in order to prescribe these medications. But if you're not quite sure if you're having this, you can ask your doctor to do a fecal fat test. It's a simple, cheap, and inexpensive way to know if you actually have these deficiencies. And then I also usually do like to test the fat-soluble vitamins for these patients also, because sometimes, they can cause excess fatigue and other symptoms that if we can get you the right vitamins on top of the enzyme replacement, then patients can feel better and they can heal faster.
Perfect. So, Christi, you're sitting in clinic and a patient comes with these classic symptoms and you're very, very suspicious of the need for pancreatic enzyme replacement therapy. You've told us a little bit that these are big capsules that patients have to take correctly. You mentioned something about 70,000 units of lipase. Can you tell us how you're making these decisions? What are you exactly telling patients? Are these pills to be taken with meals, with snacks, all the time? Just how do these pills actually translate into a patient's life?
Sure. So we do tell the patients, so you do get these pills. They're capsules. Usually you take 2 to 3 with meals, depending on the doses you're giving, and 1 to 2 with snacks on average. And it's also going to depend, and it's kind of a trial and error for each patient. Some people need more or less based on the symptoms that they have. So if you're having, frequent urgent episodes of loose stools and they're floaty and oily and gassy despite being on a dose of enzymes, you may have to go up on those. There is some suggestion, so you take them with meals or snacks, so 2 to 3 meals, as I said. And the way you want to take them is you want to eat a little bit of food and then take one, eat a little bit more, and take the other, because you want it to be mixing with the food, because you want the capsule to release at the same time as the food is digesting so that you're able to absorb the most nutrients from the food. If you take the capsule and then eat, then the capsule will be before the food, and so you won't have any benefit. And so therefore, for these medications, they have to be mixed with the food. And they definitely, and patients are like, do I have to take one every time I eat? That's a big question I get. The true answer is that no. I mean, if you're eating something like an apple here or there with not a lot of fat or protein, minimum amount of carbohydrates, you can occasionally skip one. But anything where you're eating, fat or protein, you should really take one of these pills. That includes the meal replacement supplements, which people tend not to think of as food, and are very commonly used for people who don't have good appetites while they're going through various cancer treatments. There's a thought in some patients that do not necessarily respond to the initial enzymes, and you're increasing the dose. In some patients, to help that timing align, if it's passing too quickly through the system, there's a thought that you can use a medication, an antacid medication, to prevent it from breaking down as quickly. So every once in a while, there's literature to support it, to prescribe an antacid medication with that if you're having a patient who might be having too quick absorption and the pill is not lining up correctly with the food because it's passing through too quickly. Other things that I've noticed that kind of influence this in some patients, if they're eating too much fat, we don't want to, with each meal, we don't want to restrict fat when you're going through treatment. Absolutely not. But maybe per meal, if you keep it within a certain range, or if you notice for you, and everyone's different, you're doing a food diary and you're like, when I eat this and I take my pill, I have these loose, oily stools, find those correlations in that food diary and maybe either eliminate the food for a little while and reintroduce, or, there are some common foods that some people can have harder time with that are more fatty, like milk products, red meat in particular, that patients find that, they might have a mismatch with the enzyme and the amount of fat they're taking in, and therefore still have symptoms. But I want to, again, say we never want anyone who's going through any type of treatment for cancer to be restricting their diet, because it's already already hard enough to, get through the treatments and eat. So, there's no book about how to do this. It's just kind of trial and error. And I really think a food diary really helps if you're still continuing to have problems after you start the enzymes. And then people worry about, can I overdose on enzymes? When is too much enzymes? Really, there's some limits, upper limits of what you should be consuming. Your doctors will know that, but really they're a replacement in terms of what they're made from. Your body naturally produces these enzymes, and there's no real overdose of these enzymes. I think some things that we don't think about as providers when we prescribe these things are things like the cost. Some of these medications are very, very expensive. I have some good tips that I do tell patients. There are sometimes our social workers and also our offices have coupons for you that you can help reduce your costs. But I think the most success that I found is contacting the manufacturer directly and going on their websites, because they oftentimes do have patient programs in order to reduce the payments for these medications. So you might be prescribed these medications and they tell you they'll cost, thousands of dollars when you get to the pharmacy. And so we don't want you to necessarily pay all that money to get these medications, because there are financial assistance programs out there. Also, be mindful that you can also contact your insurance company, because there are also different variations of these medications. So dosage wise, sometimes your policy might not cover, for example, one enzyme comes in like 12,000, 24,000, and 30,000 units, and your plan might only cover 24,000. So there's ways the pharmacy and your team can help to work with you so that we know the best thing to prescribe from you from a financial perspective as well, because it's important to be compliant. We need you to have these medications, and if you can't afford them, then you're not going to take them. So that's an important factor. And so just some things to think about when we're prescribing these medications is to make sure that happens. Also, I do have anyone who's going to surgery for pancreas cancer and you're not on enzymes beforehand, contact your insurance provider beforehand and see what's on formulary for your insurance. So what medications, there's not just one pancreas replacement medication. Which one is covered and what dosage would be covered best for you? I think that's really important thing that we oftentimes forget about. Alternatively, the other thing as providers we don't necessarily always good at thinking about is in terms of religion and other things. This is a pork-based medication. And so while actually the head rabbi has actually deemed that this medication should be used for patients, it's important to contact, if you're Jewish or you're Muslim, your church or your whoever you go to for your religion that governs your religion, to ask them if it's okay if you use that. But I can tell you in the past, patients have told me that in situations where they need these medications to survive, it's oftentimes something that is waived by their religion. But we always want patients to know, what they're taking. And so that's another important factor.
You spoke a little bit about financial toxicity. I just did a quick Google search before we spoke, and the price of one of these pills, at least what's listed online, is $4 or $5. So I just want to make the point that if an average patient is, say, having 3 of these pills with each meal and 1 or 2 with snacks and is maybe using 10 or 12 of these pills a day, that's quickly $60, $70, $80 a day, translating into a couple of $1,000 a month, just highlighting that financial toxicity aspect that you were talking about. And then the other thing that I found online was there were some products that you could just buy without a doctor's prescription, some things about over-the-counter pancreatic enzyme replacement. And I was wondering if you could tell us if that's safe, advisable, do patients do that, and more importantly, should they do that?
Yeah, no, that's a great point. Thank you for bringing it up. So the over-the-counter medications, we'll start there. These for multiple reasons, we do not recommend you take them. First and foremost, anything that's an herbal supplement are usually hard for us to recommend because they're not regulated by the FDA, so we do not know what is in them. So that's for one. Number two, with these enzymes in particular, the over-the-counter version only comes in very small doses. So we're talking about maybe 2,000 to 6,000 units of lipase per pill, which is much, much lower than a pill that we would give you. So you would literally have to take, bottles of this medication, and to equal the amount you would need. And so for those reasons, we do not recommend you getting them. And that's why I think it's really important to know ahead of time, work with your insurance company and these manufacturers ahead of time to help to reduce this cost. Because like you're saying, spending $80 a day on a medication is it's very expensive, especially when this is one part of your entire care. While it's a very important part, and because you can't heal, and you're not going to absorb the food that you eat, and all your other systems can't run without that source of energy. It's not something that it's something we want to help you manage, and it should not be causing you this huge financial toxicity. I mean, thousands of dollars a month is just not practical for anyone.
Great. Any other things that you'd like to tell us, Christi?
I think a couple of things. One, as the other thing I try to advise people, as you're going through treatment, it's really important to try and connect to other people who've had experience, because we can tell you about, the things that we know and what we're going through, but everyone's situation is different. So I always recommend connecting to other patients who have been through a similar situation, sharing resources. It's very important to know you're not in this alone, and we treat hundreds of patients every day, just like you. And although these are rare diseases and things that some providers have never heard of, it's patients that we see every day, just like you, who are going through this. And so if you're ever, there's always a nurse or a doctor or provider in the office who can help, connect you to other organizations that have people like yourself, as well as there are those providers in the office who can help walk you through these issues, and who know how to navigate the insurance companies and know how to navigate, exocrine insufficiency, and just making sure that you're getting enough food in so you can fight these cancers.
Well, perfect. Thank you so much for joining us. And thank you so much, Christi, for speaking with us. I hope when we're back next year, we'll have new advances for treating exocrine pancreas insufficiency and pancreas enzyme replacement therapy. Thank you.
Thank you, Arjun. Take care.
Thank you again for joining us. This podcast was made possible by the generosity of sponsorship from our friends at Lilly, Novartis, and Takeda. Please like and follow us on Facebook and Twitter. Send us feedback, share your story, donate, and visit us for more information at cancergrace.org. Thank you for listening.